brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the iPledge program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, mechanisms, resistance, and long-term management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First,
welcome to this soothing moment. Breathe calmly and feel peace. Today we're discussing how to reduce redness and swelling naturally, those uncomfortable, visible signs of inflammation that make skin feel and look irritated. Redness and swelling in your skin indicate inflammation, your body's response to perceived threats or damage. While some inflammation is part of healing, excessive or chronic inflammation creates discomfort and can damage skin over time. Let's explore natural, gentle ways to calm this inflammation. Understanding what causes redness and swelling helps you address it effectively. Inflammation can result from active acne or breakouts, irritation from harsh products or treatments, allergic reactions to ingredients, environmental stress like sun, wind, or extreme temperatures, compromised skin barrier, underlying conditions like rosacea or eczema, and stress, which triggers inflammatory responses throughout your body. The natural approach to reducing inflammation combines topical soothing treatments, lifestyle modifications, and patience for your body's healing processes. Cool temperature is one of the most immediate, natural anti-inflammatory tools. Cold constricts blood vessels, reducing blood flow to inflamed areas, which decreases redness and swelling. It also numbs discomfort and provides immediate relief. Apply cold compresses for 5 to 10 minutes several times daily. Wrap ice or a cold pack in a soft cloth. Never apply ice directly to skin. Hold gently against red, swollen areas. The cold brings quick, temporary relief and reduces inflammation over time with consistent use. Keep aloe vera gel in your refrigerator. Cold aloe applied to inflamed skin provides both the anti-inflammatory benefits of aloe and the soothing effect of coolness. Green tea is powerfully anti-inflammatory. Brew green tea. Let it cool completely, then soak a soft cloth in it. Apply the cloth as a compress to inflamed areas for 10 minutes. The polyphenols in green tea reduce inflammation naturally. You can also use cooled green tea bags directly on inflamed spots. Place them on closed eyes for puffiness or on facial inflammation for relief. Chamomile has natural anti-inflammatory and calming properties. Brew chamomile tea, cool it completely, and use as a compress just like green tea. Chamomile is especially gentle and suitable for sensitive skin. Oatmeal is soothing and anti-inflammatory. Mix colloidal oatmeal with cool water to form a paste. Apply to inflamed areas for 15 to 20 minutes, then rinse gently. This is particularly effective for widespread redness or irritation. Aloe vera gel, as mentioned, is naturally anti-inflammatory and soothing. Apply pure aloe gel to red, swollen areas 2 to 3 times daily. The cooling, moisturizing effect calms inflammation while supporting healing. Cucumber has mild anti-inflammatory properties and cooling effects. Chill cucumber slices in the refrigerator, then place on inflamed areas for 10 to 15 minutes. This is refreshing and gently soothing, though less potent than other methods. Honey, particularly raw honey, has anti-inflammatory and antibacterial properties. Apply a thin layer of honey to inflamed areas as a mask for 15-20 minutes. Then rinse with cool water. Manuka honey is especially beneficial, but regular raw honey works too. Turmeric is powerfully anti-inflammatory due to its curcumin content. Mix a small amount of turmeric powder with yogurt or honey to form a paste. Apply to inflamed areas for 10-15 minutes, then rinse. Be aware turmeric temporarily stains skin yellow. This fades quickly. Beyond topical treatments, internal approaches support inflammation reduction. Omega-3 fatty acids found in fatty fish, walnuts, flax seeds, and fish oil supplements are potently anti-inflammatory. Regular consumption helps reduce systemic inflammation, including in your skin. Antioxidant-rich foods fight inflammation from within. Eat plenty of berries, leafy greens, colorful vegetables, green tea, and other antioxidant sources. These compounds neutralize inflammatory molecules throughout your body. Stay well hydrated. Water supports all bodily functions, including inflammatory responses and healing. Drink water consistently throughout the day. Reduce inflammatory foods. Sugar, excessive alcohol, and highly processed foods can increase inflammation. You don't need perfection, but generally choosing whole, unprocessed foods supports reduced inflammation. Stress management is crucial because stress hormones trigger and worsen inflammation throughout your body, including your skin. Practice daily stress reduction. Meditation, deep breathing, gentle exercise, time in nature, creative activities, or whatever genuinely calms you. Sleep adequately. During sleep, your body performs essential anti-inflammatory processes. Chronic sleep deprivation increases inflammatory markers throughout your body. Prioritize 7 to 9 hours nightly. Gentle exercise reduces inflammation through multiple mechanisms, reducing stress, improving circulation, supporting immune function. However, very intense exercise can temporarily increase inflammation, so moderate, regular activity is ideal during flare-ups. Avoid triggers that worsen your specific inflammation. If hot showers increase redness, use lukewarm water. If certain foods trigger redness, avoid them. If stress causes flare-ups, intensify stress management during stressful periods. Protect inflamed skin from sun exposure. UV radiation worsens inflammation dramatically. Use gentle mineral sunscreen or physical sun protection like hats. Simplify your skincare during inflammatory flares. Use only the gentlest products, fragrance-free, minimal ingredients. Avoid all actives and potential irritants until inflammation calms. Use skincare ingredients known for calming inflammation. Niacinamide reduces inflammation and supports barrier function. Centella asiatica is traditionally used for calming inflamed skin. Green tea extract applied topically mirrors the benefits of green tea compresses, and licorice root extract has natural anti-inflammatory properties. Be patient. Inflammation doesn't disappear overnight. Natural methods work gently over days to weeks. Consistency matters more than intensity. However, know when natural methods aren't sufficient. If inflammation is severe, spreading, or accompanied by pain, fever, or other concerning symptoms, see a healthcare provider. If redness and swelling are chronic despite gentle care, you may have an underlying condition like rosacea that needs professional diagnosis and treatment. Prescription anti-inflammatory treatments, topical steroids, azelaic acid, metronidazole for rosacea, may be necessary for some people. Natural methods can complement medical treatment, but shouldn't replace it when needed. For chronic inflammation, work with a dermatologist to identify the root cause, rather than just managing symptoms. As we close, remember, reducing inflammation naturally requires multiple approaches: topical soothing treatments, anti-inflammatory lifestyle practices, stress management, and patience. Your body knows how to...
Acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. Gentle skincare is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer. Ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ING/DL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why: medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oil supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3, ALA from flax or chia, is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic
Welcome, and take this moment to simply breathe. Let your body relax, let your mind quiet, and allow yourself to be fully present. Today, we're going to explore something foundational, yet often misunderstood. How to understand your skin type gently, without judgment, with curiosity and compassion. Understanding your skin type isn't about labeling yourself or fitting into rigid categories. It's about developing awareness of your skin's unique characteristics, needs, and patterns, so you can care for it in ways that truly serve it. This understanding is a gift you give yourself, a foundation for making choices that honor your skin rather than fighting against it. Let's begin by releasing any pressure or anxiety around this topic. Your skin type is not a verdict or a limitation. It's simply information. Whether your skin is oily, dry, combination, or sensitive, there's nothing wrong with it. Each skin type has its own beauty and its own needs. Your job isn't to change your skin type, it's to understand and support it. Now let's explore the main skin types gently, remembering that these are general categories and your skin might not fit perfectly into any one box. That's completely normal and fine. Let's start with oily skin. Oily skin produces more sebum, the natural oil your skin creates, than other skin types. If you have oily skin, you might notice your face looking shiny, especially in your T-zone, which is your forehead, nose, and chin. Your skin might feel greasy to the touch, particularly by midday. You might notice that your makeup tends to slide off or look shiny after a few hours. You may be more prone to enlarged pores, blackheads, and acne, because excess oil can mix with dead skin cells and clog pores. But here's something important. Oily skin isn't bad skin. Oily skin often ages more slowly because the natural oils provide protection and keep skin supple. People with oily skin frequently have fewer fine lines as they age. The oil that feels frustrating now is actually offering you benefits. If you have oily skin, your needs are centered around balance, not stripping. Many people with oily skin make the mistake of using harsh products to remove oil, which actually triggers more oil production as your skin tries to compensate. Instead, you need gentle cleansing, lightweight hydration, and products that support your skin's balance without disrupting it. Now let's consider dry skin. Dry skin produces less sebum than other skin types. If you have dry skin, you might notice your face feels tight, especially after cleansing. Your skin might look flaky or rough in texture. You might experience itchiness or discomfort. Fine lines may be more visible because dry skin doesn't have the plumping moisture that makes skin look smooth. Your skin might also be more sensitive to environmental factors like cold weather or low humidity. Dry skin needs gentle care that focuses on hydration and moisture retention. Rich, nourishing products that deliver water to your skin and seal it in are your friends. You want to support your skin's moisture barrier, which may be naturally weaker in dry skin types. It's important to distinguish between dry skin, a skin type that doesn't produce much oil, and dehydrated skin, which is a condition where skin lacks water. You can have oily skin that's dehydrated or dry skin that's well hydrated. Understanding this distinction helps you address the right issue with the right solutions. Let's explore combination skin. Combination skin is exactly what it sounds like, a combination of different characteristics in different areas. Typically, this means an oily T-zone with dry or normal cheeks. You might notice shine and larger pores on your forehead, nose, and chin, while your cheeks feel normal or even tight and dry. Combination skin can feel confusing because different areas seem to want different things. The key is finding balance. You don't necessarily need different products for different zones, though you can adjust if needed. Many people with combination skin do well with balanced, moderate products. Not too heavy, not too light, used all over. Remember that combination skin is extremely common. You're not difficult or complicated. Your skin just has varied characteristics, which is perfectly normal. Now, let's discuss sensitive skin. Sensitive skin isn't so much about oil production as it is about reactivity. If you have sensitive skin, you might notice redness easily, whether from products, temperature changes, or stress. Your skin might sting or burn when you apply certain products. You might experience irritation, itching, or rashes more easily than others. Your skin might react to fragrances, certain ingredients, or even changes in weather. Sensitive skin needs gentleness above all else. Minimal products with minimal ingredients. Fragrance-free formulas. Careful introduction of any new products. Patience and attentiveness to what triggers reactions. It's worth noting that sensitive skin can be a temporary condition caused by barrier damage, not necessarily an inherent skin type. If your skin has become sensitive after using harsh products or over-exfoliating, it may calm down once you repair your barrier with gentle care. There's also normal skin, sometimes called balanced skin. This is skin that doesn't tend toward excessive oiliness or dryness, doesn't react easily, and generally feels comfortable. If you have normal skin, consider yourself fortunate and focus on maintaining that balance with simple, consistent care. Now, how do you determine your skin type? Let's walk through this gently. The Cleanse Skin Test is a simple starting point. Wash your face with a gentle cleanser, pat it dry, and don't apply any products. Wait about an hour, then observe and gently touch your skin. How does it feel? How does it look? If your entire face feels tight and looks a bit dull or rough, you likely have dry skin. If your entire face looks shiny and feels oily, especially in your T-zone, you likely have oily skin. If your T-zone is shiny but your cheeks feel comfortable or slightly dry, you have combination skin. If your skin feels comfortable all over without being oily or tight, you likely have normal skin. The blotting paper test can also provide insight. About 2 or 3 hours after your normal morning routine, press a blotting paper against different areas of your face. Hold it up to the light. If you see substantial oil on the paper from all areas, you have oily skin. If you see oil only from your T-zone, you have combination skin. If you see little to no oil, you have dry or normal skin. Pay attention to how your skin behaves throughout the day. Does it get progressively shinier as hours pass? That suggests oily skin. Does it feel increasingly tight or uncomfortable? That suggests dry skin. Does it stay relatively comfortable? That suggests normal or well-balanced skin. Notice how your skin responds to products. Does it soak up rich creams and still want more? You likely have dry skin. Do heavy creams make you break out or feel greasy? You likely have oily skin. Do you react to many products with redness or stinging? You have sensitive skin. Consider seasonal variations. Your skin type can shift somewhat with seasons. You might have oily skin that becomes more combination in winter, or dry skin that becomes normal in humid summer months. This is natural. Your skincare routine can adapt slightly to these changes. It's important to understand that your skin type can change over time. Hormonal shifts, aging, climate changes, stress levels, and even medications can affect your skin's oil production and sensitivity. The skin type you had at 20 might not be the same at 40. Stay attentive and be willing to adjust your understanding and your routine.
Supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3 ALA from flax or chia is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic licorice consumption can affect electrolytes and blood pressure. Selenium supplementation at moderate levels, 55 to 200 micrograms daily, might support skin health through antioxidant mechanisms. However, acne-specific benefits aren't well established, and excessive selenium causes toxicity. Important considerations for supplementation: supplements aren't regulated as rigorously as pharmaceuticals, meaning quality, purity, and actual content vary between brands. Third-party testing helps identify higher quality products. Supplements can interact with medications. Discuss supplementation with your healthcare provider, particularly if taking medications. Supplements take weeks to months to demonstrate benefits. Expecting rapid results leads to disappointment. Supplements work best supporting other treatments, not replacing proven acne treatments. Many people take ineffective supplements indefinitely while their acne worsens, when proven topical treatments would help. Finally, the supplement industry profits from marketing claims exceeding evidence. Skepticism is appropriate. Practical approach: implement proven lifestyle modifications, sleep, stress management, diet, and proven topical treatments first. If acne improvement plateaus, consider evidence-based supplementation like zinc, vitamin D, or omega-3s. Avoid high-dose, poorly studied supplements marketed with exaggerated claims. Guide 39: Acne in diverse skin types and ethnic considerations. Acne manifestation, treatment response, and complications vary across different skin types and ethnic backgrounds. Understanding these differences ensures appropriate, culturally informed acne management. Skin type classification using Fitzpatrick scale ranges from type 1, very fair, burns easily, to type 6, very dark, never burns. Acne occurs across all skin types, but manifestation and complication risks differ significantly. Post-inflammatory hyperpigmentation, PIH, is more prominent and persistent in darker skin types, types 4 to 6. While lighter skin types experience PIH that fades within 3 to 6 months, darker skin types often experience PIH persisting 6 to 12 months or longer. This makes PIH management particularly important for darker skin types. Aggressive sun protection, early treatment of active acne to minimize inflammation, and specific PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly important for darker skin. Post-inflammatory erythema, redness persisting after acne heals, is more prominent in lighter skin types, while PIH dominates in darker skin types. Understanding your skin type predisposes you to which complication helps target appropriate treatments. Acne scarring appears across all skin types, though manifestation differs. Hypertrophic scars, raised, thick scars, are more common in darker skin types, while atrophic scars, depressed scars, are more common in lighter skin types. Some darker skin types experience keloid scars, excessive scarring extending beyond original injury, requiring specific treatment approaches. Treatment tolerability varies by skin type. Benzoyl peroxide can appear white or chalky on very dark skin, making application inconvenient. Using micronized formulations or applying to clean, dry skin before any other products helps. Some people with darker skin prefer avoiding benzoyl peroxide entirely and using alternatives like salicylic acid or retinoids. Photosensitivity from retinoids and chemical exfoliants presents differently across skin types. While all skin types experience increased sun sensitivity, darker skin types experience more severe hyperpigmentation from sun exposure, making sun protection even more critical. Lighter skin types experience more severe sunburn from photosensitivity. Chemical peels require different approach across skin types. Superficial peels are generally safe for all skin types. However, medium depth and particularly deep peels carry higher complication risk in darker skin types, including post-inflammatory hyperpigmentation and abnormal pigmentation. Dermatologists experienced in treating darker skin types are preferable for deeper peels.
Welcome to this tranquil space. Take a slow, deep breath in and gently release. Let your shoulders drop. Let tension melt away. Today we're going to explore one of the most powerful yet underrated tools for healthy, beautiful skin: sleep. Sleep is when your body repairs, regenerates, and renews itself. This includes your skin. While you rest, your skin is working hard, producing new cells, repairing damage, and restoring itself from the day's stresses. When you deprive yourself of adequate sleep, you deprive your skin of this essential restoration time. Let's understand what happens to your skin during sleep so you can appreciate why those hours of rest are so valuable. During deep sleep, your body increases production of growth hormone, which is essential for cell repair and regeneration. Your skin cells reproduce faster at night than during the day. This accelerated cell turnover means old, damaged cells are replaced with fresh, new ones. Blood flow to your skin increases during sleep. This enhanced circulation delivers more oxygen and nutrients to your skin cells while carrying away waste products and toxins. This is why you often wake with a natural glow after good sleep. Your skin has been bathed in nourishing blood flow all night. your body produces more collagen during sleep. Collagen is the protein that keeps your skin firm and elastic. More collagen production means stronger, more resilient skin that's better able to resist the formation of wrinkles and sagging. Your skin's barrier function strengthens during sleep. The skin barrier is your protection against environmental damage, moisture loss, and irritants. A strong barrier means healthier, more comfortable skin that's less prone to sensitivity and dryness. Cortisol levels drop during sleep. Cortisol is your stress hormone, and chronically elevated cortisol can break down collagen, increase inflammation, and worsen skin conditions like acne. Sleep gives your body a break from stress hormones, allowing your skin to heal and restore balance. Now let's look at what happens when you don't get enough sleep. The effects on your skin are real and visible. After just one night of poor sleep, you might notice your skin looks duller, puffier, and more tired. Dark circles under your eyes appear or deepen. Fine lines look more pronounced. Your complexion seems lackluster. Chronic sleep deprivation has more serious effects. Your skin ages faster. Collagen breaks down more rapidly, leading to increased wrinkles and sagging. Your skin barrier weakens, resulting in increased sensitivity, dryness, and irritation. Inflammation increases throughout your body, which can worsen acne, rosacea, eczema, and other inflammatory skin conditions. Your skin's ability to heal slows down. If you have acne, breakouts last longer. If you have wounds or irritation, they take more time to resolve. Your skin simply can't repair itself efficiently without adequate rest. Even your skin's hydration decreases with poor sleep. Studies show that people who sleep poorly have more transepidermal water loss, meaning their skin loses moisture more rapidly. This leads to dehydrated, tight, uncomfortable skin. So how much sleep do you need? Most adults function best with 7 to 9 hours per night. Some people need slightly more, others slightly less. The key is how you feel and function during the day. If you wake naturally, feeling refreshed, have stable energy throughout the day, and don't rely heavily on caffeine, you're probably getting enough sleep. But it's not just about quantity. Quality matters too. 7 hours of deep, uninterrupted sleep is more restorative than 9 hours of restless, fragmented sleep. Let's talk about how to improve your sleep quality for the benefit of your skin and overall health. Establish a consistent sleep schedule. Go to bed and wake up around the same time every day, even on weekends. Your body thrives on routine. This consistency helps regulate your circadian rhythm, your internal biological clock, which governs not just sleep, but also many aspects of skin cell function and repair. Create an evening wind-down routine. About an hour before bed, begin transitioning toward rest. Dim the lights in your home. Bright light, especially blue light from screens, suppresses melatonin production and signals your brain to stay awake. If you must use devices in the evening, enable blue light filters or wear blue light blocking glasses. This wind-down time is perfect for your evening skincare routine. Cleansing your face, applying your nighttime products, these activities can become a soothing ritual that signals to your body it's time to rest. Engage all your senses. Notice the texture of your cleanser, the scent of your products, the sensation on your skin. This mindful attention brings you into the present moment and calms your nervous system. Keep your bedroom cool, dark, and quiet. The ideal temperature for sleep is around 60-67 degrees Fahrenheit. Cooler temperatures trigger your body's natural temperature drop that promotes sleep. Use blackout curtains if light enters your room. Consider a white noise machine or earplugs if you're sensitive to sound. Your bed should be comfortable and reserved primarily for sleep and intimacy. Avoid working, eating, or watching television in bed. You want your brain to associate your bed with rest, not activity or stress. Be mindful of what you consume, especially in the hours before bed. Caffeine has a half-life of about 5 to 6 hours, meaning half of it is still in your system that long after consumption. If you're sensitive to caffeine, avoid it after early afternoon. Alcohol might make you drowsy initially, but it disrupts your sleep cycles later in the night, preventing you from reaching deep, restorative sleep stages. If you drink, do so in moderation and earlier in the evening. Large meals close to bedtime can cause discomfort and disrupted sleep. Aim to finish dinner at least 2 to 3 hours before bed. If you need a small snack before sleep, choose something light and easy to digest. Exercise supports better sleep, but timing matters. Vigorous exercise close to bedtime can be stimulating and make it harder to fall asleep. Try to finish intense workouts at least 3 to 4 hours before bed. Gentle stretching or restorative yoga in the evening, however, can actually promote relaxation and better sleep. Manage stress and worries before they reach your bedroom. If your mind races at bedtime, try keeping a journal by your bed. Spend 10 minutes writing down your thoughts, worries, and tomorrow's to-do list. This brain dump can help clear your mind. Once your thoughts are on paper, give yourself permission to set them aside until tomorrow. If you can't fall asleep after 20 minutes, get up and do something calm and quiet in dim light until you feel sleepy. Don't lie in bed frustrated and tossing. This creates negative associations with your bed and can worsen sleep problems. Let's talk about your pillow and pillowcase because these affect your skin too. Your face spends hours pressed against your pillow every night. If your pillowcase is rough, it can cause friction and contribute to sleep wrinkles over time. Silk or satin pillowcases are gentler on your skin and hair. They create less friction and don't absorb moisture from your skin the way cotton does. Change your pillowcase regularly, ideally twice a week. Your pillowcase accumulates oil from your skin, product residue, and bacteria. A clean pillowcase means less exposure to these potential pore cloggers while you sleep. Try sleeping on your back if possible. Side sleeping and stomach sleeping create pressure and compression on your face, which over years can contribute to wrinkles and asymmetry. Back sleeping keeps your face free from
or vitamin C initially. After 12 plus weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep quality and acne, mechanisms, optimization strategies, and sleep-specific skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction, acne, and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or